Okay, so I'm about to start off with my critical conversation. I basically decided to kind of defer the conversation until later in his office. So basically I'm just going to go and not exactly confront him, but just kind of ask what's going on because he seemed pretty frustrated. So, scene. Hi, Dr. Janowski. So you seemed pretty frustrated earlier today. Do you mind just telling me what was going on?
Yeah, I just had a rough week. I lost a patient earlier this week, and it's just been rough for me. So my attitude's just kind of been, I just want to get through this week.
Yeah, I didn't know that, so I appreciate you telling me that now. I'll probably be pretty frustrated too, but I just wanted to bring up the point that we kind of need to maintain some professional conversation just so that we can all work together moving forward. Does that sound like something you can maybe do for us?
It was just an incident that it's a one-time thing. I guess I can try my best going forward, but you never know what's going to happen in this line of business, so.
Okay. Yeah, no, I totally understand the frustration. I definitely have had days that are more frustrating, and I understand that you're under a lot of pressure. It's just kind of difficult to work well together when we're not talking well together. So maybe next time if we could just communicate that, and instead of raising our voice and shouting, I would really appreciate it.
Okay. I'll try my best next time.
Perfect.
Thanks for coming in, bud.
All right. Okay, and scene. We are gonna move into our evaluation now. So we have our patient set up, and we're gonna start with our interview, and that's it. We're just gonna go by Tyler Janowski today. How does that sound? Do you remember your name?
Samsonite. That's my last name.
Tyler Samsonite?
Yep.
Okay. Hi there, Mr. Samsonite. I'm here to start your physical therapy session today. So I'm just going to start off with an interview. I understand that I have a couple of questions for you. You know your full name?
Tyler Samsonite.
Okay. Do you know where you are?
I'm in the hospital.
Do you know which hospital?
The hospital.
You're just in the hospital. Do you know why you're here?
I had a stroke. I had a heart attack, and then in the middle of that, I think I had a stroke.
Is that what your doctors told you?
I don't remember really.
Okay. Okay. Just to kind of get an idea of your cognition through our interview, I'm just going to give you a couple of words, and I just want you to remember those words, and then I'm going to ask you them later, and if you remember them, you pass. Does that sound good?
I'll try my best.
So we're going to go with fish, bus, and cup. Can you repeat those back to me?
Fish, bus, cup.
Awesome. So just keep those in your mind if you can. So let's get into our interview here. So can you tell me a little bit about your home life? Who's living with you currently?
Yeah, so I got my beautiful wife.
Okay.
And then we've got 3 kids. That's who's living with me currently.
Your kids are living with you?
Yeah. Or no, they're not.
Okay.
I just have 3 kids.
Okay.
It's just me and my wife though.
Okay. So how much is your wife home throughout the day?
Not very often. She's a school teacher, and so she, leaves to work around 7, and she gets home around 4.
Okay.
So, other than that, it's mainly me at the house.
Okay. As far as your home layout, what do you have to do to get into the house?
So I live in a 2-story home. It's got 4 or 5 steps going into the house, but it's got railings on both sides, but the steps are wide. Like I can't reach on both. I can only go one side or the other.
I'm gonna do one at a time.
And then I have stairs, obviously, in the house. It's a 2-story house, and I've got a partial railing going up on the right side, but a full railing going up on the left into the 2nd story, and my bedroom is on that 2nd story.
Okay. Bedrooms on the 2nd story. What about your bathing situation? Would you say?
We have a bathroom on both floors, and they both have the tubs where you have to step into them.
I see. Okay. So that sounds like a pretty decent picture right now. How do you feel about going back home, or what do you think your plan should be for discharge? I sort of have an idea, but
I'm hoping to go back home, and I think that I might be able to do everything by myself until my wife gets off work, and so that's what I'm kind of hoping.
Okay.
I don't know if that'll be a burden on her or anybody else.
Okay. So what percent of function do you think that you have right now? As far
Um,
as going throughout your day, what would you be able to get accomplished at this moment?
at this moment, I would probably say like 30%.
30%. Okay. So, what would be some of your goals for improving that 30% then? So, what would we want to get back in order to feel like you are functioning?
You know, just like being able to take care of my own personal hygiene.
Okay.
You know, being able to cook myself a meal when I'm home alone and my wife's at work.
Okay.
Just kind of being functional throughout the day, you know, and not having to rely on other people.
Mm-hmm. Okay, and how active about were you before? That kind of gives me an idea of what we can hope for gaining back.
I would say I was pretty active. I mean, I worked in a pretty manual labor job. I was lifting cement and stuff.
Okay.
And so, I mean, I know probably I won't be able to get back to doing like that full activity with what happened.
What did you do for a living? Sorry.
I was a construction worker.
Okay.
And so, but that also included, you know, lifting up 80-pound bags of concrete and cement. And so, based on what the doctor was telling me, I don't think I'll be able to get back to that. But being able to be functional again, maybe transition to, you know, a different role with the company would be nice.
Okay. Cool. So now we have sort of a bigger picture of how we're doing right now and sort of where we want to be. Just a few more specific things. How hard do you feel like you're working on breathing right now? So on a scale of 1 to 4, 1 being not very well, or 1 being pretty well and 4 being not so good.
I would probably say like a 3. It's pretty hard right now.
And what makes you say that?
Just the chest pain. I just have a little bit of pain in my chest, and it feels like I'm trying really hard.
Okay.
After they cracked me open to get this breath out.
I could imagine. Yeah. So speaking of pain, what would you put your pain level at as far as your overall, and then kind of specifically your chest?
Pain overall, I mean, probably like a 6. 6.
Okay.
Is you saying like out of 10? Probably like a 6 out of 10.
Out of 10. Yeah.
Yeah.
And then when your chest is acting up, what would you say?
I mean, it gets up there probably like an 8.
Okay.
Yeah, it's not very fun. These meds, man.
Okay. I was gonna say, how often have you been getting pain medication in here?
I mean, they give it to me whenever I'm in pain.
Yeah.
Anything that aggravates.
Well, I know that they had some concerns with taking too much pain medication, and that's why you're in the chair today. They don't want you sleeping too much.
Yeah.
Not moving will be kind of an issue as we start trying to progress. So we're going to try to keep you upright as much as possible. And then do you have any other prior health issues that I should know about?
Other than that's what's I filled out on the intake form, or my wife filled out. Nothing that I can tell you. I mean, that high blood pressure is that big one.
Yeah, and then I believe heart failure as well.
Yeah.
And then what would you say your nutrition was like before?
Pretty bad.
Pretty bad. What's the cheeseburgers, right?
Yeah, dude. I love me some good red meat.
Yeah.
But I mean, who could blame us?
Okay, yeah, right. Okay, and then before we get into our exam, I'm going to ask you those 3 words again. What are they?
Fish.
Okay.
Bus.
Yeah.
And then the last one I think started with a C, maybe cash.
It was cup, so 2 out of 3. But honestly, I do bad with that one too, and you seem pretty with it right now, even if you are tired.
You asked me a lot of questions, and I forgot.
Yeah. No, I understand. Okay, so first thing we're going to start you off with is we're just going to do some vital signs. Okay, so we're just going to start you off with vitals today. So currently you're hooked up to some lines, and we can see that your heart rate is about 100, so that's a little bit high. But I'm just going to manually take your blood pressure if you want to move your leg over that way.
Might need a bigger cuff. Been lifting smell the bags of concrete.
Yeah, it's good you have a sense of humor still. Some people lose that in this place, so that is good.
Man. If I lost that, I'd be
What would you have if you did?
Yeah. Already lost my right side. You can't lose my sense of humor.
Okay, that was just trying to find where I need to pump the cup up to, and then we will go ahead and take the blood pressure now. So I got 122/70 for you. I believe the patient form says something in the 130s, so we'll be sure to add that to our note. Okay. So the next thing I'm going to do is I'm going to go ahead and have you remove your gown. Theoretically, he would have a gown on that we would be able to just take down, but I'll just have you take your shirt off. You can use your arm for right now if you need to. Oh, he's dedicated. We'll start off with some heart sounds, so you don't have to do anything. You just have to sit there and let me listen. All right?
Is this gonna be cold?
It will be a little chilly. I'm gonna warm it up for you. You can try to do that if you'd like. So everything is sounding relatively normal there, so that is good. Next thing I'm going to do is place this on a couple of places and listen to your breath. So I'm going to have you place it here. Breathe in as much as you can. I know it's probably a little difficult, just as much as you can. And then I'll tell you when to breathe, and I'll listen, breathe, listen. All right?
Sounds like something I'm able to do. Especially on these pain meds.
Yeah. All right, go ahead and breathe in. Okay. And then breathe in. Okay. Breathe in. Okay. Breathe in. Good. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. And then breathe in. Okay. So it is feeling or sounding relatively clear. Has anybody taught you, if you do get any buildup in your chest, has anybody taught you about airway clearance yet?
They mentioned it, but those people don't tell me anything.
I was actually going to kind of go over some of your external precautions, and has anyone taught you about moving your arms and things like that? Not yet.
They talked about it, but they haven't shown me anything.
Okay. Well, what are they doing over here? I guess they're waiting for me, huh?
Yeah,
So
they said you were the expert.
Okay. Well, we can kind of talk about both of those things together. So you know that you had the incision. It's kind of hard to ignore, right? it's a bit tough to ignore, but there's a lot of things that you can do with your arms that'll hurt it even more if you don't do anything yet. I'm gonna tell you.
Confused.
Yeah. So basically lifting your arms both forward like this past this much. So go ahead, that much. Perfect. And then go ahead and relax. That's as far as we want to do it, and we only want to do it with one arm. So, and then the same thing outward like this. Anything that's going to put stress this way on the chest. And then backwards as well. Don't want to be putting our arms backwards at all, really. I wouldn't like that. For right now, that's probably going to put a lot of stress on that area. And then the last thing was just going to be no pushing, pulling, lifting more than 10 pounds, and then also airway clearance. So coughing and sneezing are kind of like, you got to do it, but it's sort of a no-no with this because it puts the most stress on the sternum here. So I want to teach you something called huffing.
Well, 10 pounds, how much does a 2-liter Mountain Dew weigh?
Less than 10 pounds, I think, but
Okay.
I think we should maybe lay off the Mountain Dew for a little while until we're feeling better. But
all right.
Okay. So basically, you know how to cough already. Don't do it. Don't demonstrate. I don't want you coughing. If you feel like you have anything stuck in your lungs, basically what I want you to do is instead of doing a big cough, we want to almost make a breath sound like this. And see, it comes a little bit more from your stomach and puts a little less stress. So go ahead and try that, just like that. Okay, try one more. Okay, and okay, perfect. So just in the future, I want you to keep that in mind. Just if you feel like you're getting clogged up, which I know you have a chest tube, it's kind of draining, and you have a lot of buildup because you had a lot of trauma happen with the surgery. So just making sure that we continue to keep our lungs as clear as possible, and then obviously if you need help with that, I'm sure the nursing staff will help you out as well. So next thing you're going to do is just kind of take a look at the incision. So just looking for redness and swelling and things like that. And I mean, this is done fairly recently, so it doesn't look pretty yet, but it will look better eventually.
You saying I'm not pretty?
I'm saying your chest might not be right now.
All right.
Okay. So I think I'm gonna go ahead and run you through a couple of tests now. We're gonna do these things called dermatomes. So we're just trying to see what your sensations like. Oh, you know what I'm talking about? Sorry. See what the sensations like on your arms and your legs. So just go ahead and tell me same or different when I touch two sides. So you do with your eyes open first. I'm gonna touch two sides like this. I'm gonna have you do eyes closed for the test. That sound right with you? Okay. Can I just take this?
Yeah.
Sorry. Gown's in the way of the testing area. Okay. And so go ahead and close your eyes. And then I'm gonna same or different?
Same. Different.
All right. Same or different?
I only felt it on my left.
Yeah. Okay. And then could you put your hands on your? There you go. Ready? Same or different?
Different.
Same or different?
Different.
Same or different?
Different.
Same or different?
Different.
Okay. Now we're gonna move to the legs. I'm gonna have you come on here. Same or different?
Different.
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 Okay, when you're saying different for all of these, what are you feeling on the right side? Is it just completely gone, or is it like a little fuzzy, or is it like?
I definitely feel it on my left, but it just doesn't feel like the same. Like I guess the feeling on the right isn't as much as it is on the left. Like I guess you would say maybe like the intensity or something.
Yeah. So does it feel kind of almost like pressure, but like numb? Like you can't feel.
Yeah, it doesn't feel. I mean, it just doesn't feel like you're touching. I don't know. It's hard to explain.
Okay. We'll leave it at that. We'll just leave it at it's different, and we'll kind of reassess that as we go on, and we can talk about that later. So the next thing I'm going to do is kind of do some muscle testing with you. So first thing I'm going to have you do is just try to shrug your shoulders up. Perfect. And then I'm going to push you down. Actually, I'm going to do just the left side first. Push you down here. Okay. Make a bicep.
Good luck with this one.
And then push down. And then wrist back like that. Then fingers out. And then go ahead and grab my fingers. And don't let me pull out.
Sorry, I'm kind of sweaty.
I'm a little sweaty too. It's sort of warm in here.
And tell someone to kick on the AC.
Okay,
Seems like there's a nice window to open.
Would you like me to open the window?
Would you please open my window? I haven't been able to get up and move to do it.
Okay.
Thank you. Well, fresh air won't kill me, right?
There's a train going by. That's fine. Okay. So next thing I'm gonna have you do, we're gonna do the same stuff on this side for the upper body, and we're gonna see how you do. So go ahead and try to lift this as much as you can. And then you can't really take any resistance there. Can you try to flex your arm up like you're making a bicep on the right side? Okay. And then how about try to push down into my hand? Okay. And then can you get your hand into that position like that? Okay. And then try to spread out your fingers as much as you can. Okay, so the next thing we're going to do is pretty similar, but it's going to be for the lower body now. So basically, just going to have you take your left and try to pick it up like that, and I'm going to push it down. So pick it up, keep it there, push it down. Okay, now kick that left leg out. Out. Yeah. Okay, and then try to pull it back in. And bring your toes to your face. Toes to the floor. Just big toe to the face. Okay, now we're gonna give it a shot on this side. So let's see how much that you can lift up this right leg. Okay, got a little movement there, and then not very much resistance. Put it down. Go ahead and try to kick your leg out. And try to pull your leg back in. Okay. And then can you kick your toes towards your face? Okay. And then down towards the floor. Okay. Big toe. All right. So we're seeing a little bit of weakness on that side, which is pretty consistent with your strokes. I mean, the good news is we're still going to be trying to do some more mobility today. Believe it or not, we can get you up and walking with the strength that you have in your other leg, your right leg. Basically, I'm just going to help you as much as you need to, but I think we're going to do that later. I'm going to do one more test, and then we're going to get into some mobility tests if you're comfortable with that.
Whatever you want, Doc.
Okay. So
I'm just trying to get better.
Okay. So the next thing we're going to do is just test some of these cranial nerves. I don't really suspect that there's going to be any issues, but you never know, and I just kind of want to get a second opinion on that. So first one we're going to do is smell. So I have some cinnamon and some coffee with me. I'm going to hold, here it is, the cinnamon. Here is the coffee. Okay. And what I'm going to do is have you close your eyes. I'm going to hold one up to your nose. You tell me if it's cinnamon or coffee. Ready?
Mm-hmm.
What is that?
Coffee.
Okay. What is that?
Coffee.
Okay. And what is that?
Cinnamon.
Okay. Perfect. So it looks like that's intact. Next, this one's a little bit fun, but I'm going to shine a light in your eyes, and we're just going to see how your pupils are reacting. And just, okay, perfect. Next thing we're going to do is just some eye movements. So I'm going to have you follow my pen. There you go, a little bow tie here. Actually, I probably shouldn't tell you that. Okay, great. Now let's see. Go ahead and close your eyes. I'm going to touch some points on your face, and you can kind of just tell me where it is.
It's my cheek.
Which one?
Right. It's on the forehead.
Which side?
Middle. Forehead left. Cheek left.
Okay, you got it. Next, can you raise your eyebrows? Can you smile? Can you frown? Can you puff your cheeks up? Can you pucker your lips? Alright, perfect. Next, I'm gonna have you just demonstrate, can you swallow effectively right now? Easy, okay. And then the last one is just sticking your tongue out. Perfect. So everything seems to be intact there. We already tested some stuff with your strength, with your shoulders, so that should be good. So I think I want to get into one more intervention thing. I know you're having some trouble getting some breaths in. I just wanted to show you maybe some more effective ways to kind of strengthen those muscles. I know it hurts, but there's ways to kind of get air in and not have it hurt so terribly. So we're just gonna do something where instead of, you're already taking smaller breaths in, so basically you're gonna keep doing that, but you're gonna take small breaths on top of each other and then breathe all the way out with pursed lips, like that. So I'll demonstrate, it'll be so we're taking tiny breaths with little holds, trying to get as much air in as we can while only taking little breaths, and then pursed lip blowing out. So go ahead and try that for me. Perfect. How did that feel?
Fine. Felt good.
Okay.
I felt like there was some air getting into my lungs more than my normal breaths.
Okay. Okay. So let's try one more of those, and let's just kind of make a thing out of it here, and see if we can get you feeling a little bit better as far as energy goes. I know you can get more air like this. Okay. And how are we feeling now?
Good.
And then I'm checking your O2 stat. It's actually up over 90 right now, which is pretty good. So now we're going to try to get into some of our mobility tasks. It's going to be the last thing because it is going to be kind of tiring for probably both of us. But
can I put my shirt back on for those?
Yeah, you absolutely can. Go ahead. I was actually going to say before I put the gate belt on to go ahead and toss your gown back on.
Yeah. My gown exposes a lot, so
Yeah.
didn't want to just be hanging out in the hospital with my gown off. Might frighten some people.
Okay, so I'm going to toss this gate belt on for you. It's just for your safety and mine. It's an easy way to make sure that you don't fall over on me, and we'll be able to call for help if you do. So please feel as safe as you can. Making some rookie mistakes with the gate belt there. Please forgive me. You
Yeah,
didn't know that.
I don't know what this thing is, so you're doing it right.
Okay. All right. And how does that feel? Too tight, too loose?
That's fine.
It's fine. You sure?
Yeah.
Okay. Perfect. So what I'm gonna have you do is we're just gonna try standing up first. I'm gonna have you try as hard as you can by yourself, and I'm just gonna give you a little bit of assistance. And then we'll just kind of add assistance as you need it until we're standing up. We'll take a couple of steps. Now what I need you to do is I'm going to be watching the monitor here to make sure that there's nothing going on with your heart. But what I need you to do is tell me how you're feeling when you're standing up. And if you're not feeling well, we got to go back to the chair. Okay? Sound good? Okay. So you go ahead and try to stand up here. I'm just going to have you. Okay. Good job. Perfect. Okay. How are we feeling here?
Doing good.
Okay.
It's been a while since I stood up, so a
Okay,
little
well-
lightheaded, but that's expected, right?
So you have a walker that you came in here with, so we're just going to go ahead and place that in front of you now, and we're going to try a couple of steps, alright?
Okay.
Okay, so
How should
You
I
let
be
me know.
doing this?
go ahead and try to lead with your left, and I'm going to help you with your right. So go ahead and just try to take a step. Yep, perfect, I got you. So if you're feeling steady, okay, as much as you can. Okay, how are we feeling?
This is
A little
amazing.
tired?
Yeah.
A little tired.
It's great to be walking, but I'm a little tired now.
Okay, so let's try turning. So we're gonna keep this foot planted and just start stepping. You're gonna go that way.
Yeah.
That'll help your foot this way. Okay. Okay. And then maybe start taking some steps that way with your left. Perfect. Then we are going to sit back down as safely as we can. Okay, good. How are we feeling right now?
Oh man, it's the first time I've walked in a while, so
Yeah?
it was great, but I feel exhausted.
Yeah, tired. How's your chest feeling?
I mean, it's been worse,
Okay.
but it's been better. So
And breathing feels...
everything feels good. It felt good to get upright and kind of get, felt like my airways are a little bit open, especially after doing that, the short breaths in. I felt like I had a little bit more in me.
Okay, good, good. Yeah, see your oxygen didn't go down very much. It's about at 88, so we'll just watch that. Hopefully that comes back up while we're resting. The next thing I'm gonna have you do, this is actually all part of a kind of a little test. I'm being sneaky here. But the next thing I'm gonna have you try to do is transfer over to the bed by yourself, or scooch over to the bed. I don't know what they taught you the word transfer here. But I'm gonna give you as much help as you need with that.
I think I should be able to get it. My
Okay,
left
well,
side is pretty strong.
I'm here if you need to. Okay, perfect. Wow, great job. Wonderful.
Those cement bags aren't light, buddy.
No.
I've been lifting
No,
them
they're
since
not.
before you were born.
Yeah. I'd say it seems to be helping you out now, so that's good. So, I already took care of walking. Do you feel like you could walk stairs today or no?
Probably
Like, you
not.
able to reach.
That'd probably be too much. I mean, I got tired. What after that? Those 5 steps I took.
Okay. Yeah, we'll go ahead and hold that off, and we'll just do kind of our bed mobility.
But maybe next time if I see you that we could try the stairs.
Oh, I plan on it.
Okay.
I definitely plan on it.
I think that's for me in my house. I think that's a good thing for us to work on. Just not today.
Well, yeah, we'll see where you progress. I mean, we can talk a little bit about where we're gonna do discharge after we get you laying down here. But first, let's just go ahead and do one thing at a time. Now, how do you feel about trying to lay down in your bed right now?
Oh, I mean that's pretty easy. I mean I could just flop down. I don't really. My right side's not feeling too well.
Well, what I'm gonna try to do is, I know you can use your left side very well.
Yeah, I mean I could.
So I'm gonna try to control this leg. There you go. Okay. And go ahead and just lay back as much as you can. Great. And then how do you feel about turning? I know you don't have a lot of room in this bed actually, but turning in one direction or the other.
If I throw my arm over, it's pretty and
Okay.
push.
You can do
So
that
it's
independently?
pretty-
Oh, wow. Perfect.
Yeah.
Okay.
It's just if I push through that leg, that's good. It's pretty easy.
Okay. Anything on the right side, do you think, or going to the left, do you think you could try?
I mean, I could still kind of push off that leg. I just change the position a little bit. It just takes me a little bit longer.
Okay.
It's not as quick. Can
You are
keep up with
you are passing my little test though, so I like that.
Good. I was never a good student, so at least I'm passing something.
Okay. And then the one last thing we have to do is trying lying to sitting. So, and then we can lay you back down. I know it's a lot up and down, but it's a part of my little spiel that I'm doing here.
All right.
So, do you think you need any help with that?
No, normally I can just grab the side of my bed and kind of
Okay.
shimmy my way up.
And then I can control your leg here. Perfect. You're killing it. Doing great. And how's that chest tube doing? I know we just did a lot of moving around. I want to make sure that you weren't rolling over
It's
that.
fine. I was moving around a
It's
lot
just-
before I saw you.
Yeah, exactly. Okay. So I just want to have a quick conversation about discharge planning before we get you laying back down and you can finally rest for today. So
Can I lay back down before you start talking to me?
if you want to,
All right.
very independent of that. Okay. So what I'm hearing right now is that you want to head home for discharge. I would say at the functional level you're at right now, you did really well with your 6 clicks test, other than the stairs. That's for just being discharged to a different facility, something like skilled nursing. Also, there's a lot of things about your house that are going to make things difficult until we can get you doing stairs, until we can get you stepping over the tub. I just think right now it might be a good idea to kind of set our goal a little bit lower. You don't have as much family support at home, and that's not really their fault. It's just people got to work and things. So basically, I was thinking skilled nursing would probably be a good choice for you after your stay here. do you think that that's something that you'd be willing to do?
I don't know. I have to talk it over with my wife.
Okay.
I don't know. Today went a lot better than I thought, so I guess I don't know. I'd have to see my progress while we're in here.
Yeah.
Maybe as like a plan C to going home is maybe plan C would be going to that skilled nursing facility,
Okay.
but it's not at the top of my list.
Okay. Well, I'm gonna do what I can to get you to where you want to be. For right now, I'm just gonna say on my document, we're planning to go to skilled nursing unless we see a crazy increase in function before you leave here. Does that sound like okay to you?
I mean, you're the expert.
Okay. Well, it was a pleasure working with you today, Mr. Janowski. I will go ahead and leave you alone and let you rest because you did a lot of good work today.
Thank you. Thank you so much for helping me out.
Yep.